First, I want to thank each of our witnesses for joining today's discussion, which will be the first in a series of hearings focused on the federal government's preparation for and response to the coronavirus pandemic. We have to examine and confront our failures, identify and build on what went right, and propose reforms to ensure our nation can combat this pandemic and be better prepared to prevent and respond to future pandemics, which we know will occur at some point, and other public health threats. I appreciate Ranking Member Portman for joining me to conduct this bipartisan oversight of the federal pandemic preparedness and response efforts. This approach is another clear example of how this committee is stronger when we work together. And no challenge requires a bipartisan approach more than tackling this once-in-a-lifetime pandemic. Since the first cases were diagnosed in the United States, more than 562,000 Americans have now lost their lives. And while Congress has provided critical relief over the course of the pandemic, millions of Americans lost their jobs, families continue struggling to make ends meet, and countless small businesses are forced to close their doors permanently. More than 4 million Americans getting immunized every day, and the number of deaths from coronavirus are declining. So there is indeed light at the end of the tunnel. But we're not out of the darkness yet, and I'm concerned that as cases continue to rise, particularly in my home state of Michigan right now, that vaccines are certainly an important step to prevent the spread of COVID-19, but we still need to practice social distancing, wear a mask, and follow the advice of public health experts to get this resurgence of the virus under control, especially as variants continue to spread all across our country. Tragically, it didn't have to be this way. The lives lost, the permanent changes to people's personal health, the economic devastation, and the long months of personal sacrifice and suffering were not inevitable. Adherence to years of pandemic planning by prior administrations, decisive action, clear leadership from the Trump administration could have helped mitigate this pandemic. In fact, since the first whole of government pandemic response plan was published in 2005, the United States had ample opportunity to prepare for this type of public health crisis. Professionals across our government spent years working to improve our pandemic preparedness, from a pandemic response playbook drafted by the National Security Council in 2016 to a 2019 Department of Health and Human Services series of exercise called Crimson Contagion that simulated a highly contagious airborne influenza pandemic. In 2019, I conducted an investigation and released a report that identified the serious national security risk posed by our over-reliance on foreign manufacturers for critical drugs and medical supplies. My report found the United States was unprepared to deliver vaccinations on the scale needed during a pandemic, and made critical recommendations that could help onshore manufacturing for essential supplies. Unfortunately, despite preemptive actions and warnings, the previous administration failed to take necessary steps that would have limited the impact of this coronavirus pandemic. Instead of acting swiftly and decisively, the previous administration chose to sideline our nation's foremost medical experts and failed to implement a comprehensive national strategy that left individual states to combat the virus all on their own. In fact, we know President Trump was aware of the virus, that it was both deadly and contagious as early as February 2020. However, he continued to tell the American people it would, quote, miraculously disappear, end of quote. And initially even compared the effects to the common flu, when scientific evidence clearly showed that coronavirus was much more lethal. At a time when the administration could have provided clear and consistent communication, supported scientific guidance on needed public health measures, and ramped up production of PPE and other critical medical supplies through emergency contracts and fully invoking the Defense Production Act, among other critical actions, the previous administration sought to rather downplay the virus severity to the public. On top of those failures, there have been numerous reports of widespread political interference in federal agencies' COVID-19 response, including reports that the Health and Human Services political appointees reviewed and may have altered or delayed weekly scientific reports issued by the Centers for Disease Control and Prevention about the pandemic. The Trump administration's inactions and efforts to minimize the threat posed by COVID-19 contributed to the carnage our communities have seen over the past year. Despite representing only 4% of the world's population, by January of 2021, the United States accounted for nearly a quarter of the global COVID-19 cases. There's no question that the federal government must learn from these missteps and urgently work to strengthen our pandemic response to ensure that we can both combat the ongoing pandemic and prevent the next crisis, whenever it may be, from reaching the magnitude we have seen with this one. Today, we will hear from former officials from key agencies in the federal government, all of whom are widely credited experts in their respective public health and emergency preparedness fields. I look forward to a very frank and open discussion and clear and candid recommendations about what we must do to prevent past mistakes from moving forward. It is our duty to ensure that our nation is better able to meet whatever the next crisis may be. With that, I turn it over to Ranking Member Portman.